This video is intended for personal use only. You should consult with your physician prior to starting an exercise program. The goal is to be active every day, whether it is using this program or walking around in your home or neighborhood. If you use this video, we recommend you use it 3 times per week. Please make sure you've taken all your prescribed medications, had something to eat today, and hydrate appropriately. If this is your first time watching this video, please take a moment to listen to the following suggestions. Otherwise, skip to the exercises. The things you will need to participate in this video are a sturdy chair, preferably with no arms, and some weights. If you don't have dumbbells, consider using household items that weigh 1 to 2 pounds. A bottle of water, a can of soup, or a sock full of pennies or rice. Many of you are already participating in a rehab program. You can start with the weights you are using in that program. If you have not been participating in a program, use 1 to 2 pounds to start. More is not always better. If you have diabetes, you will need to monitor your blood sugar pre and post exercise. Your blood sugar should be above 100 before and after exercise. If it drops below, make sure to eat more before your next session. If you have access to a blood pressure machine, monitor your blood pressure pre and post exercise. As part of your cardiac rehab program, you should be weighing yourself daily. If you weigh 3 pounds more than yesterday or 5 pounds above your baseline weight, consult your physician. Make sure you're maintaining good posture throughout the exercises. Sit up straight with feet flat on the floor. For those familiar with the 6 to 20 Borg scale, try to work around a 13 to 15, or somewhat hard for indicating your rating of perceived exertion. When is it too much? If it hurts or you can't maintain good form, then you've done enough. You may need to decrease the weight if you can't perform at least 8 repetitions. If you start to feel anything unusual, such as dizziness, chest pain, shortness of breath more than usual, new or worsening swelling, or feeling uncomfortably hot, stop the exercise and consult your physician. Now we will start with the exercises. The exercises will be broken up into intervals of aerobic and strengthening parts. You will do a set of aerobic exercise, then a set of strengthening exercise, ending with another aerobic exercise set. You will then have a 30-second rest before the next interval. Warm up. We'll start with some easy movements. Starting with shoulder rolls, let's do 5, going backwards. Now stand up and perform some standing marching. Interval 1, side jacks. Start in standing and step to the side and raise your arms overhead. Then step to the other side and raise your arms overhead again. Continue for 30 seconds. If this is too difficult, you can sit in a chair and move your leg out and move your hands side to side. Bicep curls. Start with your arms at your sides with palms facing out and bend your elbows. Repeat this 10 times on each side. Now, repeat side jacks. Interval 2, Modified Grapevine. Start in standing and take a step crossing behind your standing leg. Then switch and perform with your other foot. Repeat for 30 seconds. If this is too difficult, you can sit in a chair and do toe taps backwards with an arm pull. Overhead press. Next, we will perform the overhead press. Start with your hands at your shoulders and press up overhead. If you are experiencing any pain with any exercise, stop. Repeat for 10 reps. Perform the modified grapevine again for 30 seconds. Interval 3, arm and knee ups. Start in standing and lift one leg to hip height with a bent knee. As you do so, reach your arms overhead. Perform the same with the other leg and repeat for 30 seconds. If this is too difficult, you can perform seated with or without arms. Sawing. Stand up and bend slightly at the hips and bend your elbow. Pull your arm back, then lower your arm down in front of you. Repeat 10 times. Repeat arm and knee ups. Interval 4. Arm swing step outs. Start in standing and step to the side and swing your arms out low, then at waist height, then at shoulder height, while alternating sidestepping. If this is too difficult, you can lower your arms or perform seated. Sit to stands. Start sitting in a chair and stand up. Try not to use your arms. Use a higher surface if this is too difficult for you. Repeat 10 times. To do arm swing step outs. Interval 5. Side lunge and reach. Take a step to the side and lunge slightly. Reach to your knee with your opposite hand. Repeat on the other side for 30 seconds. If this is too difficult for you, use no arms or perform seated and alternate knee reaches. Knee extension. Start sitting with a rolled up towel under your knee. Kick one leg up. Perform 10 reps, then switch to the other leg. When you completed this, do another set of side lunge and reach. Interval 6, sumo deadlift high pull. Start in standing with your feet wider than hip width apart. Do a squat, then stand up and pull your arms up to chest height. If this is too difficult for you, sit down and perform the arm motion. Knee raises. Standing or sitting, start lifting the knee up to hip height in standing, or lifting your thigh off the seat of the chair in sitting. Repeat 10 times. Perform sumo deadlift high pull for another 30 seconds. Interval 7. Step forward and press. Take a step forward and push your arms out in front of you. Repeat on the other side. If this is too difficult for you, you can sit in a chair and push your arms forward, tapping forward with each foot. Hip extension. Holding on to a solid surface, kick your leg back in a small range of motion. Make sure you're moving at your hip with a relaxed knee. Perform 10 times on each side. Repeat, step forward and press. Interval 8. Arm pull with reverse lunge. Start standing and take a step back, pulling your arms back with you. Switch and perform on the other side. If this is too difficult for you, you can perform seated, pulling your arms back and tapping your toe behind you. Side leg raise. Holding on to a solid surface, take your leg out to the side in a small range of motion. Perform 10 times, then switch sides. When you've completed this, perform arm pull with reverse lunge again. Interval 9. Quarter squat with arm lift. Start in standing and sit back slightly while raising your arms up to shoulder height. Stand up and repeat for 30 seconds. If this is too difficult for you, perform without doing the arm movement. Calf raises. Holding onto a solid surface, go up onto your toes 10 times. When you've completed this, do another set of quarter squat arm lifts. Cool down stretching. Now let's stretch your legs. Start with sitting on a chair. Stretch one leg out in front of you and straighten your knee. Sit up straight and lean forward until you feel a stretch. Hold for 20 seconds on each side. Next, to stretch your calf, put your hands on the back of a chair, step one leg back, and keep that knee straight. Hold the stretch for 30 seconds and repeat on the other side. That concludes our exercise program. If you have any questions, please do not hesitate to call us at 212-305-4695. Thank you for participating in our program.